Okay.
Dr. Chiu, let's talk about gum disease. And I have a very important question here, something which is just bugging the heck out of me. When I hear dentists talking about gum disease, what I hear always is that they keep saying, if you do not fix your gum disease, you will lose your teeth. Now, that's a bad thing, because you have explained how losing teeth might get you headaches, might get your face look ugly, may shrink your bones, and that's why you look ugly like a dried-out tomato. You will automatically create more different tooth loss. It's obviously expensive to fix them, so all those things. But one thing is for sure, that you dentists can replace teeth very, very well. I mean, I'm sure there's some rich people who want to look very good. They pull them all out and put a whole array of implant in it to just look the way they exactly want to look. So obviously, it can be done. However, here is and as bad as it is, here is what I think, and you tell me whether I'm wrong. If it takes 1, 2, 5 years, whatever it takes to lose a lots of teeth with the gum disease, during that time, a person has an infection in the mouth. His mouth is infected. Never mind that it is probably stinky and smelling, but it's and maybe even ugly looking, because the gums start looking ugly and the teeth start looking like like a tree which is about to fall out. It looks ugly, but doesn't the body get infected? I mean, there's data out about heart disease, and there's data about strokes. There's even data out that here in California, where we live, that babies get born premature. The mom has a premature birth, and thus the baby gets born underweight. In California, apparently, one woman was found with gum disease, pus, that yellow, ugly stuff in her placenta. The baby was stillborn. A very, very isolated incident, I'm sure. But if that type of stuff can happen, wouldn't that be also create a lowered immune system, which some people in Japan, some researchers in Japan in the university say, and all kinds of things? Wouldn't that be much more devastating than the tooth loss, which at least can be fixed? Tell me.
It's very true. Gum disease, what it is a chronic infection that causes for someone to have bacteria from the mouth traveling to the blood, and a constant bacteria that travels through the rest of the body. And what can happen, it can cause a lot of different problems. That has been shown that has been related to diabetes, just as you said, heart problems, stroke, and many other different issues. But these are the things that we're just finding out right now. So it is important to try to control this disease, because it does affect the rest of your body. It is in the mouth. We call it a silent killer. You don't really know, you don't really feel, you don't have any symptoms, you have a disease, and until the tooth falls off or until it's too late. But it is something that's affecting a great amount of our population, and not many people know about it. So it is a problem that I see quite a lot.
Well, I've heard that, for instance, a gum disease, gum disease, the infection is almost as big as your hand. Imagine somebody having an infection on his arm, on his leg, in his face, anywhere. They would run to a doctor right away. I mean, a person with an ingrown toenail has an infection, and he goes to a doctor, and he should, as he should. But in the end, it is a small infection compared to the big infection, and isn't an infection an infection? It wouldn't matter where you have that yellow, reddish, ugly pus, whether you have it in your hand, in your foot, in your knee, in your back, it travels into the blood. In fact, is it true that the gums, the mouth area, is the gateway to the blood vessels? Everything goes into the blood very fast, like take a little bit of salt or something like that under your tongue, and boom, you feel it right away. Am I right?
Yes, it's very true. And one of the biggest sources of infection is come from the mouth. It's just when you have that gum infection, you just have all that bacteria slowly traveling into your blood system, into the rest of the body.
Wow. So, and yet, really kind of like for all purpose, they call it whatever heart disease and stuff like, a silent killer or whatever. It comes on, your cholesterol builds up, blah, blah, blah. But apparently, it might possibly be that the biggest silent killer there seems to be perhaps a gum disease, because obviously it doesn't hurt, as you said. People bleed a little bit, they don't care, it doesn't matter. Nobody sees it. They probably get used to the stinky mouth. I don't know, maybe their spouses do not. What do I know? But the point is, it creates all these other problems, so it perhaps could be called the biggest silent killer we might perhaps have in our body.
Yes, exactly. We'll tell with time, but right now it's just, as I pointed out, the research is showing has been linked to different diseases, and we might find more problems in the future. We don't know at this point, but it is a very important topic that we need to address with patients.
For instance, I spoke to a surgeon there, months ago, and he said that he will not perform surgery, just about any surgery, if the person has gum disease, because if the person has gum disease, potential complications when doing any surgery, which any surgery is toxing on the body. It's a surgery. You just don't, you're doing something to the body which the body is not made for, and the body needs to be in good shape to survive any surgery better. So this surgeon just simply doesn't want to do it, especially if it's any complicated surgery. He doesn't want to do it before gum disease isn't fixed, because he says, I am risking the body because it's already being weak because of the gum disease. So if I start cutting in it, the whole system might not take it. What is your take on that?
Yes, I agree with that. The potential of, if you're doing a surgery on another body part and you have all this bacteria traveling in your blood, that area might get infected or might not heal correctly. So the risk of getting infection on that area is higher. I agree. Sometimes some surgeons don't want to take a chance doing that. So it's always good to make sure the mouth is free of disease before they do any surgery. Even chemotherapy, same thing. Or you're going through treatment, you want to make sure you take care of all your dental problems before you're going to undergo other treatment where it's going to affect your immune system.
Wow, yeah. Well, I mean, if surgeons refuse surgeries, that's the thing they're here for, to cut in. And if they say, well, wait a minute, your body has a gum disease, and more that is happening, so that's just one more indicator that, yes, your gum disease is an infection, and an infection anywhere in the body just isn't a good thing. It will slowly kill your other organs, your vital organs, kidney, liver, heart, blood and stuff. Well, again, Dr. Chiu, thank you very much for shedding light on gum disease, and maybe I should end off that video and get my butt to a dentist and check whether I have gum disease. Thank you very much.
Thank you. Thank you for having me.